Okay, my dear students, let's start a discussion on health and contagious diseases. What are the main contagious diseases? Look it up. Norovirus or stomach flu, influenza, meningitis, hand, foot and mouth disease, HFMD, sexually transmitted infections, STIs, MRSA, tuberculosis, TB. So, these are some of the main contagious diseases. What are the main agents of contagious diseases? Yes, bacteria, virus, flies, mosquitoes, then animals like rats, etc. are some of the main agents of contagious diseases. Is it? Then here are some ways to maintain our health. First one, don't smoke. Eat a diet high in fruits and vegetables. Exercise regularly. Maintain a healthy weight. If you drink alcohol, drink only in moderation. Get adequate sleep. Take steps to avoid infection, such as washing your hands frequently and cooking meats thoroughly. Try to minimize stress. So, these are some of the main ways to maintain our health. Then, suggest some nutritious food items to improve our immunity power. Let's look it out. First one, citrus fruits. Most people turn straightly to vitamin C after they have caught a cold. That's because it helps build up our immune system. Vitamin C is thought to increase the production of white blood cells, which are key to fighting infections. Almost all citrus fruits are high in vitamin C. With such a variety to choose from, it is easy to add a squeeze of this vitamin to any meal. Popular citrus fruits include grapefruit, oranges, clementines, tangerines, lemons, limes. Then red bell peppers, broccoli, garlic, ginger, etc. are some of the nutritious food items. So, vitamin C helps to improve our immunity system. Okay. Then, do you think cleanliness is a major reason to spread contagious diseases? Yes, surely. Some of you have the habit of throwing waste here and there, isn't it? From such waste and wastewater, flies and mosquitoes will grow rapidly and it increases the rate of the spreading of contagious diseases. Okay. Now, I am going to show you an article, The Effect of COVID Trauma on Our Mental Health. I will read it for you first. Doctors say that first it is important to understand the toll COVID-19 is taking on our collective mental health. MC Bright says, we are seeing the effects of widespread trauma on society. Trauma is the reaction to feeling unsafe. We are wired for safety, and with an invisible, ubiquitous and potentially lethal virus in circulation, we simply don't feel safe. As a result, people are struggling with fear, vulnerability, worry, depression, and often adopt behaviors to numb those uncomfortable feelings. The DC-based doctor says the trauma is only worsened when you or someone you know or love actually gets COVID-19, as her husband did in November. The anxiety of having it in your home is intense. You have no idea if your loved one will experience minor symptoms, end up in the hospital, or die. You also worry about who else you might have infected without knowing it. The ripple effects are huge. With more than 21 million cases confirmed in the United States, these fears are widespread. Having this level of fear, vulnerability, and certainty hang over our heads for months takes a toll that has vast amount of people needing professional mental health support. But that help can be hard to find for a variety of reasons. COVID-19 has basically poured lighter fluid on a pre-existing fire. That is one of the hardest things about seeking mental health care. When we need it, we are often emotionally and mentally overwhelmed and unable to find it. PhD Senior Director of Practice Transformation and Quality at the American Psychological Association and a licensed clinical psychologist who sees patients in Maryland. Add to that, right now, the sources of support we normally rely on, like friends and family, are likely socially distant because of the pandemic and may also be equally overwhelmed, stressed, struggling, and unable to help like they typically do. Our capacity to cope is stretched pretty thin right now. There are often financial barriers too. Mental health services often aren't covered by insurance and getting help is generally pricey. A session of therapy costs 65 to 250 US dollars in the US, but most people say between $100 and $200 per session. Mental health professionals in the US are also stretched quite thin now. We have our members telling us that they are busier now than they have been and that they have more referrals than they know what to do with. Bafka says people are seeking help everywhere. There are wait lists and it is very hard to keep up with the demand right now. There are shortages of mental health professionals before the pandemic. Data shows there were 30 psychologists and 15 psychiatrists per every 10 lakh people in the US, and in some places that ratio dropped to just one professional for every 30,000 people. So, this is an article on COVID stressing the nation's stress therapy system. I hope you have got an idea. Now, all of you have to read it loudly at your home. Okay. Now, I am going to give an activity for you. You have to prepare 2 slogans on the theme Health is Wealth. I will give you a model. So this is my version. You can't enjoy wealth if you are not in good health. He who has health has hope, and he who has hope has everything. So this is my version. You have to prepare 2 slogans like this on the theme Health is Wealth. Okay, let me conclude. What all we have discussed today? Yes, what do you mean by health? Health means the physical, mental and social well-being of a person. Then what is meant by contagious disease? It is a disease that is spread by the transmission of a pathogen from one person to another. So the main agents are bacteria, virus, mosquitoes, flies and the animals like rats, etc. Then proper diet, regular exercise, etc. maintains our health, and we should all include food items that is contained with vitamin C to improve our immunity system. Okay.